We have spoken extensively about the data behind the EDCs and the potential effects they can have on both human health and our environment. But there are real people behind the scientific data presented, and the effects caused by EDCs disrupt lives all across Europe. It is my privilege to introduce Kenneth Nielsen, spokesperson of the Korsør Cow Grazing and Nature Conservation Association, and we are really thankful that you will share your personal story with us. And before we welcome Kenneth, Tina will give a short introduction to the...
Come up, Kevin.
Yeah, you can come up anyway, but Tina will stay here.
I'm not going to give Kenneth, he can speak for himself. Yeah. I know that. I've known him for a long time, but I think...
to the floor.
I think, welcome, Kenneth. I think I was not the one working mostly with you. Welcome up here. But we worked together, and Kenneth worked a lot with the people from the Holbæk Hospital who helped the people who were exposed, and you worked a lot with Anne Lyngbe, and I was only sort of in the backstage of this. But I think what is very, very important in this is that you have to keep the people involved. And Kenneth is the, what we call it, the chair, or what are you? Chairman. And we've been, every time we do something, do information campaigns, talk about how we reduce, and we also done studies with pharmaceuticals to try to reduce exposure. We always do it by talking to Kenneth and his group to know what would the people accept and what do they think, because this is just as important as us doing research. Thank you for being here, Kenneth.
Thank you. And thank you for letting me come here to speak to you. It's very emotional for me. I will get into that in a short while. How we found out we were exposed, I will skip that part because that was a very funny story also. Not funny, tragic story, but it all happened on a Friday morning. 10 days before, I have donated a beef to the department where they check food, and I received a call, and the lady, Lulu, in the other end said, "Do not eat your cow. It's polluted. It's so much polluted that it's not suitable for eating, not for humans, and not for animals either. Do not put the meat in the bio bucket. You have to put it where it could be burned. Otherwise, it would go on in the nature." And when you get a call like that, you think automatically, what does this mean to me? I Googled PFAS, and like Tina said, there was 5 or 7 hits on Danish. One was from the environmental ministry saying all the bad things about PFAS. And one of them was, of course, cancer. I have never had cancer. Some of you may have had cancer. And the first thing you think about when you have a diagnosis that probably could end in cancer is, am I going to die? That was my reaction. That was the reaction of all the cow grazers. It's about 200 people, give and take. And getting the knowledge on a Friday is a very bad thing because you want to contact your doctor. The doctor is closed. So I had the worst weekend in my life, worrying about what about me, what about my children, what about my grandchildren. I had a daughter, 6 months pregnant. I will come back to that in a moment. And on Monday, I called my doctor, said, I've been exposed to PFAS. I know it's toxic and there are health issues with this. And I can hear her type on her computer. And after 1.5, 2 minutes, she said, I can't help you. I don't know anything about PFAS. And I thought, what should I do? I don't know. So she hung up. And I was angry, frustrated, and you can imagine all the things go through your mind. That's where the press and the media came into the picture. Every day I was on television, I was in the radio, I was in the newspapers saying, who's going to help us? Nobody had so far helped us get an answer to what to do about this. 10 days later, Anne from Holbæk called me. She introduced herself. It was at 7:30 in the evening. She said, "Hi, I'm Anne. I'm going to help you, but I don't know anything about PFAS." This is 4 years ago in Denmark. No one except for a few people, professors, knew anything about PFAS. One of the things we encountered in our family is my daughter. She was 6 months pregnant. I had already one grandchild. She had a lot of, she was very sick often, and we didn't know why. And when you get the message that you have PFAS in your body, and it potentially is dangerous for you to breastfeed your child, then you want to know, is it good or is it bad? And we asked Tina and Grazing and all the different people who knew something about that, and they couldn't agree about it. There were good things about breastfeeding and bad things. The bad things Tina already told. The good things are also known here. So my daughter had to make the decision herself. Should she breastfeed or not? She chose not to breastfeed. That had, of course, the economic effects, but nevertheless, the hardest consequences was the emotional consequences of not breastfeeding. It was her third child. She had breastfeeded the two first, and she told me that it had a huge impact on how she connected with her daughter, that she couldn't breastfeed her. My daughter and I were in a documentary on TV2 East 1.5 years ago, and in that documentary, we were asked to get a line out from our doctors how many contacts we have had with the health system. I hadn't had any particular, but 1.5 years after my daughter had my grandchildren, number 3, with the 2 youngest children, she had over 200 contacts with the health system in Denmark. And like Tina said, it was fever, it was all the things you can imagine that Tina also had told you about. We had a whole community in despair, like I said, over 200 people. We got some help. We were tested. We did get the numbers of how contaminated we were with PFAS. But until 1.5 years ago, there was no treat for this. Today, we know that a medical substance can get the PFAS out of your body. And I know that one of the cow grazers wanted to get pregnant, had problems with getting pregnant, was given this medication prior to trying to get pregnant, because, as they said, it couldn't hurt getting the PFAS out to see if she had a better chance of getting pregnant. And today she has a beautiful daughter. Today it was PFAS. What about tomorrow? As you all heard today, we know what we have today. We don't know what we have in the future. My recommendation to the authorities are that they should take care of the citizens and take them serious, not only make statements about things they're not sure about. That was how it all started in Denmark. If they are unsure about it, check up the facts before making the statements to the public. The citizens will become insecure, and that does not do any good for the people. As Tina also said, in Danish products imported, 3 out of 4 contain PFAS. Another investigation from Tænk said that in the household, 3 out of 10 products in the kitchen contains PFAS. So we have a huge problem here. We were very much exposed, but we are only around 150 people in Denmark who has a number of PFAS contamination. Imagine how many people in your country at home who does not know how much or the effects of it. So take it seriously, listen to the community, listen to the citizens, and as politicians, listen carefully to what they say, because they might have ideas and solutions and angles on the matters that are quite different from the doctors. Thank you for letting me speak here.